So, welcome to our Summer Public Health Internship Pre-Application webinar. Thanks to those of you who joined us live and who just completed your introductions. It was really fun hearing about all of your snacks and where you're coming from, and a little bit more about you. So today we're going to be Oh, we just have another person joining. Okay. Um, so we're just about to get into the content for today. Here we go. Okay, so I'm sure if you made it to here, you have seen something about our internship program, whether that is through social media, or through our website, or maybe the job posting itself. But I wanted to give a brief overview of really what is this program? And we'll talk a little bit more about who we are as Urban Indian Health Institute and the Seattle Indian Health Board. And we'll hopefully have tons of time for all of your questions. Okay, let's get into it. So the public health internship, we'll talk about the details of the specifics of what the program looks like, but what is it fundamentally about? And that is learning about public health in an Indigenous way. And so what does that mean to us? Hopefully that becomes clear as we go through these things. The first thing is that we recognize that we build our own health and wellness from the strengths and the solutions in our communities. Oftentimes, things that are about Indigenous people are not done by and for Indigenous people. And so one of our missions here at Urban Indian Health Institute is decolonizing data. And that means data by and for Indigenous folks. And part of that is our internship program, training this next generation of Native and Indigenous public health professionals. So what do you do? A majority of your time here will be engaged in impactful projects. It changes from year to year and based on what our community needs. But all of our projects, you'll have the chance to contribute to some important work that we're doing here at the Institute. And there will be room for, mini projects and kind of tailoring the work to what you're interested in. The other thing is a huge part of public health in general, but especially how we do it in an Indigenous way, is being engaged with our community. So you'll have opportunities to connect with our community through direct public health service, but also through outreach events, tabling at things like the Seafair Powwow, and helping out our outreach team in a lot of different ways. So engaging in our and serving our community. We call our community our relatives. So patients, community, both we refer to as our relatives. Another big part of this is mentorship. So making connections, building out your personal and professional network as an Indigenous public health professional. So that'll be done through mentorship with myself as the internship supervisor. You'll also have a project supervisor that you'll build a relationship with, and we'll engage in site visits with community partners and have mentorship and learning opportunities in that way as well. And then I talked a little bit about it, but the bulk of the curriculum will be around Indigenous evaluation, our work in research and surveillance, and as I said before, direct public health service. So let's go into not just the program, but who we are as Urban Indian Health Institute. So we are one of, also, I'm so sorry about the construction. So if at any point you need me to repeat myself, just please unmute and I'll repeat anything. So we are one of 12 tribal epidemiology centers, and we are the only tribal epidemiology center that serves our primarily urban population. next year we will actually be celebrating our 25-year anniversary. We've been doing what we do since 2000. So we support a whole network of urban Indian serving organizations, and we serve the national scale in many, many different ways. A few are highlighted on this slide. Like I said, we are fundamentally interested in being grounded in Indigenous values and methods, and not just focusing on health disparities or problems, but on identifying and understanding solutions and our own resiliency using those Indigenous methods. And some other ways that we contribute to this work is by strengthening our public health capacity through amazing programs like this internship program, and our typical epidemiology work, which is in the like disease surveillance and as well as prevention programs. Okay. So I have something fun for you all. Um, we are on TikTok and we are also on socials. That may be where you've seen the information about this webinar, about the program in general. We're going to take a quick second to watch one of our videos that gives a fun and very brief insight into what it's like working here. And you'll also get to see a little bit of like the inside of our office and some familiar, beautiful faces. So I'm going to stop sharing my screen and Lena is going to start sharing hers. And I'll show the slide with our socials again. So if you need to like take a picture, screenshot, or scan the QR code, you can make sure you're following us.
We work at UIHA. Of course we're decolonizing data.
We work at UIHI. Of course we're passionate about public health and epidemiology.
We work at UIHI. Of course we got that native drip.
We work at UIHI. Of course there's cedar above the door.
We work at UIHI. Of course we love Cody and our studio.
We work at UIHI. Of course we got drums at our desks.
We work at UIHI. Of course we love going to Hello M every day.
We work at UIHI. Of course we refer to our community as our relatives.
We work at UIHI. Of course we know what an urban native is.
Okay, so that's, hold on, I need to start sharing my screen again. That's like a fun little video that shows a little bit into kind of what we do. Hello M is this really amazing Vietnamese coffee place that's like like a 5-minute walk just right down the road. So that's what she was talking about. But yeah, so feel free to like screenshot this, scan the QR code, make sure you're following us on socials. That's where we'll post like updates about everything. Okay, let's get into what I'm sure you're all dying to hear about, and that is the nitty-gritty details about the program. So who is eligible for this program? Who is this program for? So you may have seen this either like in our social media posts or on the job description, but we do have some pretty specific eligibility requirements. The first is that in order to be eligible for this program, you must self-identify as American Indian, Alaska Native, and or Indigenous. And in this case, Indigenous is a umbrella term that for our purposes refers to those that are Indigenous to the US and territories that are occupied by the US. And then again, if you have any like personal questions about eligibility or any questions that require divulging personal information, we can get to that after the recording. The other eligibility requirements that are important for you to know are that you must be 18 years or older, you must have a high school diploma or GED by the position start date, and this is an in-person only opportunity. So you will be able to, or you will need to be able to join us for the entire session. which starts on June 17th and ends August 30th. For those 10 weeks at our main clinic, where we're all joining from today in the International District in Seattle. And an important thing to note here is that we do not provide housing or any housing support, unfortunately. So you will have to find a housing situation for that time period if you are joining from outside of the local area. Does anyone have any questions about this slide or the past couple slides that does not require like personal info? We'll also have an opportunity during the Q&A section. Okay, I'm just gonna keep going, but feel free to stop me at any point. Okay, so this slide, what are the what are the steps for the application? We're actually going to navigate away from this and I'll show you like directly on the website. But the first step of the application process is to determine if you're eligible. So that slide that we just went over, making sure that you check all those boxes. And then the three components that we'll talk about in just a second are the resume, the cover letter, it's actually four components, the application and the writing sample. And if you've already applied, you may have noticed that there's not like a area to submit your writing sample, and we'll talk about that as well. So I'm going to stop sharing my screen and start sharing in just a second. And if you do have the ability to follow along, like in your browser, I know some of us are joining from phones, so that might not be a possibility. But if you are joining and have that available, I really recommend following along with me in your browser. Okay, so I'm just going to start from like a blank Google, and I'm going to get there the fastest way that I can, which is uihi.org/internship. It just redirects you, and it's the easiest way to get there. If you were joining just from like our regular homepage, uihi.org, you could go hover on the About UIHI section and click on Summer Internship Program, and that's like the second easiest way to get here. So I'm going to highlight some specific resources on this page, but first I think we should just take a second to look at the application itself. So we have a link here. I'm just going to open it in another tab. And this may be familiar to some of you, especially if you've already submitted your application, but this is the actual where you submit your application. And this is the job description. And there's a little section about how you apply. And I'll talk about this more, but basically you'll just enter your info here and that is like starting the application. And then in this Paycom form, you'll have like several different like sections to complete. So I did just want to highlight kind of like how to read this or like what are important things to take away from this job description. I recommend like with any job description or any opportunity, making sure that you really thoroughly understand all of the components. I will answer your question, Brecken, in just one second. So you'll want to make sure that you thoroughly understand each component of this description. And I would say, especially paying attention to like what is necessary for me to have a complete application, this how do I apply? And then also looking at the qualification section to inform your resume and cover letter. I would make sure that you really understand our core competencies, organizational responsibilities, and the duties and responsibilities of the position, that you just understand it as written and that you come to the rest of the process with what questions you have still. Are there any questions like specifically about like getting here or anything specific to the public health intern position? Okay.
Oh, I did
Yeah,
have a question if you don't mind.
please. Yeah.
I'm curious where we submit the writing sample.
Yes. I am just about to get there. So,
Sorry.
no, it's a great question. Thank you for asking that. So, what's the best way? Okay. Sorry. Long story short, there isn't an opportunity unless you have it in like additional documents to submit it in your application. So we do have in the second stage of hiring, there will be a like screener form where you'll answer the eligibility questions, and then there will be like a submission box for your writing sample. So if you are able to attach it like through like additional documents, that's fine, but you'll also have another opportunity to submit your writing sample in the second stage of the hiring process. So yeah, does that answer your question, Alisa?
Yes, thank you so much.
Yeah. Um, yeah, I think that is all my points on here. The other thing is we're going to go over the resources that are linked here on the website for your application. So the website, like we have here, this is the link to the public health internship. But then we have these three sections, and this is where I'll answer Brecken's question. Um, Unfortunately, we do not have the fellowship application live at the moment. There will be some updates to this page very shortly. Yeah, there's just internally, we've had some processes that we need to go through for that opportunity. So the deadline will be a little bit different, and there will be more information coming about the fellowship very soon. Yeah. And then the other thing to note is that usually we do have a youth internship. I know that none of us here are high schoolers, but that this program is not discontinued. It just is not occurring this year. So yeah, today we're talking about the public health internship here. So this is the same link that we just went to this. Yeah, and then this page has a lot of really great info. Not only do we have like some great quotes and pictures from past internship years, but there's also this frequently asked questions section that I really recommend everyone who's interested familiarizing themselves with. And yeah, I'm not going to go into it because you have access to the website. I really recommend reading some of these profiles from past interns, as well as watching this short video from a previous intern. And then I really wanted to highlight these two resources here. So these are from Purdue University, and they are just some easy resources around creating a cover letter, an effective cover letter. And there's tons of like examples. There's some templates and some additional notes, and then the same thing but for resumes. So if you have not if you have not created one before or would like some support, we recommend these two resources. And then again, for your writing sample, it can just be whatever you feel like shows your writing skills. So it could be a blog post, it could be an essay or a research paper from a class, it could be an opinion piece that you're really proud of, it could be whatever. And if you have any questions about like, does this count or would this be good? You can feel free to email us. We'll be sharing our contact info again at the end. So does anyone have any questions about navigating this website or about any of the resources that we've kind of gone over in this section of the presentation? Okay, so I'm going to stop sharing this and start sharing the slides again. I just want to do a brief recap. So the components of the application, there's that Paycom like application form that we just went over. There is a resume, which you submit as part of the application form. There is a section that says resume and that you'll be able to upload. A cover letter, you'll also be able to submit in additional documents, and we do ask you to submit it with the rest of your application. And then that writing sample, if you have an opportunity to submit it with the rest of your application, please feel free to do so, but you'll have another opportunity during the second stage of hiring. Yeah. The next section is actually the open Q&A. And my slide literally says questions. So I'll show that briefly to give you a second to think. But we are now in our open Q&A, and you can ask myself as the internship supervisor and hiring manager. You can ask Lena or Kylie as current UIHI staff, or Lauren as current staff and as a former intern. You can ask any of us anything about the program. Just try to keep those personal questions until 2. So let's just get started. I'm going to stop sharing this. You all know it's question time. And then, what is coming up for you all?
I have a question. How many internships are available in the summer?
Thank you, Trish. That's a great question. There are 4 public health intern positions. And usually we also have a youth internship that is not happening this year. And then there is 1 fellow. So we have 1 fellowship program called the Decolonizing Data Fellowship. And if you have more questions about the fellowship, I'm sure Lauren can answer those as it is by her team. So there will be 5 summer interns, 4 public health interns, which is the program we've been talking about. And then the 5th one is the fellow. And that application is not live just yet. Yeah, Brecken?
Hi, thank you. Are there any software applications that are recommended to be proficient in prior to beginning the scholarship or the program? I can expand on that too if
No,
so okay.
I totally know what you mean. Like, should you know how to use Excel? Should you know how to use like R or like that kind of thing?
Yeah,
Like
yeah.
proficiency wise?
Yes, I have R proficiency, but I'm still learning a couple different like qual softwares. So just curious on that.
Yeah, so I definitely recommend like really thoroughly looking at the like qualification section, but I will say that we do not um, have any specific qualifications that require like any specific software. So
Okay.
yeah, so that is not part of our quals. Yeah.
Okay.
Yeah, like just general like Microsoft Office would be like a safe like threshold.
Yeah, I would say like if you know how to send an email and use a website, like that would probably be like my minimum qualifications. But we don't have any specific technical quals and we're willing to train from wherever you're at. Additional questions?
Around
Yeah.
when or what time would you know like you've been accepted into the program?
Yeah, that's a great question. So, I know I didn't go too far into like the different stages of hiring. We have like that first stage, which is the application we've been talking about. We have the second stage, which is the form that I briefly mentioned, where you'll answer those eligibility questions and submit your writing sample. And then the third stage is a phone screening. Um, so one of us on the hiring committee will give you a quick call and we'll speak briefly. And then the next stage of hiring is a panel interview. So it would be you and a few panelists from our side. And then all of that, hopefully you would know by mid-April. So that's our goal is early to mid-April to notify folks if they have been accepted. So that would give you just about 2 months to secure housing. Any other questions about that or that are coming up about hiring timeline or other questions? I have a question for Lauren. What would your advice be to like someone who's really considering applying but is not sure if they qualify? Like they meet the eligibility requirements, but is not sure like if the opportunity is for them. What would you say to someone in that position?
I mean, really, I would just say go for it because I when I began this internship, I actually public health was never on my radar. Actually, I had gone to community college and been out of it for I think 2 or 4 years, something like that. And I was working at a grocery store actually before this, and so I didn't think I was qualified. Had major imposter syndrome, the whole shebang, and um, yeah, I would just say just give it a shot, because like like wherever you're at right now, it doesn't necessarily like label you as like only capable of like that level of things, if that makes sense.
Does anyone have any other questions or things that they're interested in? It can be about like the day-to-day program activities. It can be about hiring or what we're looking for in the application. It can be more questions for Lauren as someone who has actually been a participant in the program. Or it could be about what it's like to work at UIHI or even working in Seattle. Yeah, what are you curious about? This is the time to answer and ask any questions.
Yes, I do have another question then. I know when I was reading over on the website, it said that interns or fellows are often put with projects they have interest in. Um, is that like a wide interest, or is there a couple projects that you're planning to kind of place interns with this summer?
Yeah, I do have some more information. So hold on one second. Sorry, I was echoing pretty bad. Sorry about that. So for projects, I know that in the job description, we listed like some potential topics, like chronic disease prevention, infectious disease, substance misuse, and maternal child health. Those are just kind of focuses for us as a tribal epidemiology center right now. But all of the projects will be chosen by our director, Abigail Echohawk, and our director of research and evaluation, Lenise Baker. So our leadership will be choosing the projects based off of our current needs as an agency, which really translate to like what our relatives or what our community needs. When we say like based on interest, like throughout the hiring process and also throughout like that first week, um, there will be like a conversation and selection process of like um, which specific project you'll be interested in. And right now, like it's always subject to change, but right now we're thinking there will be like each intern will have one main project, which they like work with a supervisor on that project and work with the team that's doing that project. But then there will likely also be a mini like group project that everyone works on together. Yeah, and then yeah, it could be across like all of our different things. So like if you're coming in with like a interest in evaluation or an interest in direct public health service or an interest in epidemiology, I really recommend making that known throughout the hiring process. So either in your application, definitely in your cover letter, in your interviews, like what kind of work do you envision yourself doing? And we'll see like if that aligns with what we're up to. So it kind of goes both ways. And there will be also opportunities to engage in work while you're here through kind of connections that you make and through things that come up. So we're always responding to the current picture and the current needs of in Indian countries. So there will be times where like you have an opportunity to jump in on a project that we didn't even know was going to happen at that time. So I hope that answers your question. The other thing I can say about the projects is that we will not have any projects that interns will work on that are related to missing, murdered Indigenous women, girls, and people. And that is because, like in the past, Lauren and Abigail's team has worked with interns on MMIWP work, but there are not opportunities this summer that would be appropriate for someone who's only going to be here for 10 weeks. Any other questions? We have about 5 minutes and then we'll go to like personal questions.
I did have a question that's kind of related. Um, I was just kind of curious how accommodating the organization is for working class people and students who would still need to maintain another job outside of this in order to pay for housing and food and all that. Like, do y'all accommodate schedules to any degree, or is it a set, you need to be here 9 to 5, Monday through Friday for these 10 weeks?
So of course, like when it comes to like any sort of accommodation, there's like a certain level of like case by case basis. I will say like because this program is so short, it's just the 10 weeks, and because the work requires you to be in office, it is likely that like you will need to be here for the scheduled time. That doesn't mean that throughout like the process, we couldn't figure out something that supports your needs. But I will say like the hours for the internship will be 8.5 hour days, Monday through Friday. So yeah, as far as like the schedule and like coming in office, like it is pretty set, but we do try our best to work with where everybody's at and where they're coming from.
Thank you.
Yeah. And I will say, like, a lot of not just interns, but staff also work additional jobs. And so, yeah, you definitely wouldn't be alone. Anything else coming up? We have a few minutes left. Okay. Why don't we end the recording